Being part of our Upper Cervical Council does about 3 things for you, if you don't mind me going into that. First of all, we kind of learn from all of our techniques that are part of our affiliate process. So our affiliates are actual techniques that have decided to sign with us, support us, and it's reciprocal. They go through a vetting process, and once they're affiliated with us, we start to bring them into the conversation. How can we support you? How do you support us? Can you educate us on what you're finding, and so forth? What we do is we sit down at a table and we learn from each other's techniques. It doesn't mean that I am taking my technique, blowing it apart, and using everybody else's systems. I am taking observations that they have seen and I'm adding it into my perspective. Sometimes that does mean when you have a complex case, maybe thinking outside the box and using that methodology more. Sometimes it does mean adding extra analysis systems into your understanding what's happening with a person's spine. But that's been a very profound thing that's come out of our council. The other thing we do is we move upper cervical forward. So when I speak on a platform, I will always speak as an upper cervical doctor first. I will not be speaking as a person who does. Right now, my main technique is Atlas orthogonal. I don't speak as my technique. I speak as upper cervical care because, again, it doesn't help for us to go in our silos and only speak about our techniques. That only gives a very small nuance to what happens. When we go and speak on stages about upper cervical care, we give a broader perspective and open the doors for other people. I have brothers and sisters all across in different techniques. I want them to have just as much shine on them as I do for my technique, because honestly, the technique is only as good as the person using it, right? So there are many different specialties out there, and I want them to look at it and go, that's specific upper cervical care. That's the kind of stuff that I'm looking for, not a said technique. Again, that limits our ability to actually move through doors. So that's the other thing that we do. We move the actual field of upper cervical forward. And then the other thing is politics. Honestly, Dr. Christopher Kent says that, you may not be interested in politics, but politics is interested in you. And the thing that happens in our world is imaging right now. That's a big thing that's on our plate. Imaging could be potentially taken away at some point. Canada's in a challenging position and they have asked us to come on board and help them. And so our council does those kind of things. We have a lot of those people that sit on our council. And so we're working on the research. Right now, combing CT is a big thing in the upper cervical world. A bunch of us have it in our clinics. And we have specialty committees that are working on creating white papers on how to use it properly, creating research, pushing these things through state boards. And then we have guidelines, we've been working on for years and they're almost finished, a refined guideline that says if you are seeking upper cervical care or craniocervical junction care and you're a paraprofessional or even a chiropractor outside of our world, here's what you can expect from our analysis systems. Here's what you can expect from how we adjust and how we look at it. And here's what you can expect from us as outcomes, right? So we put that in a guideline setting, which most places have as an established thing, at least most healthcares. And that's what, if another healthcare is looking at another healthcare to see if it actually fits for their patients, they start with their guidelines. So we are putting out our own guidelines and they are subluxation focused. So the things that the ICA loves, the Upper Cervical Council loves in a nerdier way, probably, because we actually get in a very specific, focused in way about the upper cervical spine. But if any of that interests you and you want to help that move forward, it doesn't happen in a vacuum. People who are on the council right now, especially our board membership, it's all voluntary. Like time, money, and commitment and all the things are given away freely by the people on that board. And we need more help. And part of that help really can be simply, if you don't have the time and commitment, your dollars are useful. If you want to be a member, be a member. That money is used wisely. I can tell you right now, and my husband and my family will tell you, the amount of hours and commitment that we voluntarily give to the council is worth every single dollar that you have spent as a member. It also, as a member, gets you into great opportunities that we are getting right now because of our hustle. And it gets you into those seats. It gets you in at a cheaper rate. It gives you lots of opportunity to join us and collaborate. We've created masterminds over the last few years, and our diplomates have been part of that, and our candidates for our diplomates have been part of that. And we have come up with some really excellent stuff to go forward. And really where we house ourselves in the upper cervical world is, how can we help you do better with your patients? Right? We're not a business collective. You might have some business acumen that comes through our world, but we're not the business model people. We're the people to help you help your patients better. I always tell people, I'm not here to give you business advice. I'm here to give you purpose. And that's what our Upper Cervical Council does. So that's what I think we offer. And I hope that people will decide to join our membership because we could totally use the support.